Hello, I'm Susan Robinson from the U.S. Centers for Disease Control and Prevention. While today the remarks I will make are my own, not the official position of CDC, I think I can say on behalf of all of us, we thank you for applying your creativity and talent, and I'm sure hard work to help fight COVID-19. So let's go to the slides that I have prepared. Here's the bottom line of my talk up front. You can save lives by providing people with key information they can access, understand, and use to take action. The goal of communication during a pandemic is to make clear the danger and what is not the danger, to make clear what actions people need to take, and finally inspire them to take action, to protect themselves and others. Communication works best when people receive support to take action. More on that in a minute. As you put your game together, think about the balance of gameplay and providing some good, solid information in an entertaining way. I mentioned that communication can't do it all. It works best when combined with other public health actions to support people in fighting disease. For example, in the case of COVID-19, the call to action, use hand sanitizer, has been greatly supported by the placement of hand sanitizer everywhere by organizations. The idea that people think differently during an emergency is common sense, but here's a quote: "The risks that kill us are not necessarily those that anger and frighten us." What does this mean? Frankly, this question's a deep one. I've given you on this slide some ideas to look up, and CDC has a lot of resources on this topic at the links provided. I will give you one theory to consider, the mental noise theory. When people are stressed out, they have difficulty hearing, understanding, and remembering information. How might this play out in your game? Another important principle to remember about communication in a crisis is this: trust is the most important factor in being able to get life-saving information to people and motivating them to act on it to stay healthy and save lives. So what design decisions might you make around the factor of trust in your game? So health communicators have a laser focus on making sure we're communicating to the people who are at risk or people who may be associated with risk factors. For example, for COVID-19, we know that elderly adults are most at risk for serious illness. Yet also caregivers of elderly adults are a top audience because they have close contact with them. The links I've given you here will provide you with lots of ideas regarding audiences for your game based on different factors. Deciding on which audience to focus on and what messages or information to emphasize go hand in hand. It's an iterative process. Let's say you've chosen older adults. Maybe your grandmother might play your game. The way a communicator would think about the messages would be to make sure that the unique messages older adults need to get are emphasized. For example, older adults need to get emergency care for their medical conditions right away, not wait. A big principle of communicating during a public health crisis is to engage people. It's not enough just to send out the information. Can you connect with, even by Zoom, some of your target audiences and talk to them about what they're feeling, thinking, or doing about COVID-19? And then, can you get members of your audience to test play your game, give you feedback? If I had to make a game, what tips would I want? Here's 3. First, I'd make sure I had someone on the game development team whose focus is to make sure the health information was the best it could be. Secondly, always check the accuracy of the information or model you're presenting. Science evolves. So as you start to finalize your game, recheck the facts, recheck your science, use up-to-date labels and words, such as masks instead of face coverings. Finally, health behavior theory and health communication theory can inform your game models. Just take a look at some of the resources provided at links on this slide. Fighting COVID will happen on multiple levels, at the individual level, at community level, and policy level. So that gives you lots of possibilities for situating your game at different levels. In closing, there's so much work to do in creating your game. Be on the lookout for anything that is algorithmic or can be represented as variables. So in closing, I wish you the very best of luck in developing your game, and thank you again for joining the fight to jam the COVID-19 curve. Take care and stay safe.